Ready? Keep that tummy tight and ready. Push up, 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 up. And arms, bend your arms. Bend your arms.
I'm
arms,
Katie Moureau. I'm caregiver to an 8-year-old with Prader-Willi syndrome. I've been in clinical trials with my twin 2-year-olds too. We've done several trials, more recently, more DCT and hybrid models. We have participated in clinical trials because I think it's really important to continue finding a cure or relieve some of the caregiver burdens that are out there for those with Prader-Willi syndrome.
That's okay. I like that you're not giving up. Keep trying.
Some of the things that we go through on a day-to-day basis is driving around to multiple therapy sessions a day, making sure we're at where we need to be to get him his medication. Cade has a very restrictive diet. If he gets sick, then we're kind of stuck at home because he's round-the-clock care every 4 hours, getting a percussion vest and nebulizer treatments, plus his medications. And if we have to go to the hospital, then that's even more difficult for our family because, well, I have 5 boys and we never know how long we're going to be in the hospital. We actually just enrolled in a recent study where it is hopefully adding PWS and Angelman syndrome to the newborn screening. I think it's really important to get that early diagnosis out there and help alleviate some of the things that those with Prader-Willi syndrome struggle with. I think DCT trials, while many people feel that it takes the connection and the personability out of it, I've been able to reach the researchers either by phone or email and setting up Zoom when needed. They're still able to relate to you and understand what you're going through and help you through troubleshooting things or talking you through each step of the clinical trial.
Up, 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 up. Good job.
Some of the app features are really good. I've had great apps that I've worked with when recording data on how things are going with the reminders, I think is really helpful. Having DCT trials does give me more hope for the future. I feel that being in the rare community, it's a rare disease. So there's already a limited number of participants. And now throw on top of that, are they able to afford to drive or take off work to travel to locations to do the clinical trial? That's difficult on families. Having a DCT trial, you're able to do most of that, if not all of that, in your home. And having that, I think that's just going to help us move science forward and give children and all those with rare diseases more potential for their future and less burdens, not only on their families, but also on them.
It's a race, Kate. They're catching up.